So welcome to Northern Powerhouses, our business success stories series of interviews where we discuss with local business leaders, their backgrounds, their successes and challenges, and what really drives them forward. And this morning, I'm delighted to have with us Paul Johnson, who's the CEO at Radar Healthcare. So firstly, Paul, thank you so much for coming on the interview. And if you'd like to introduce yourself and Radar Healthcare to the audience and let them know how you help people, that would be great.
Yeah, no, thank you very much. Thanks for having me. Yep, Paul Johnson, CEO at Radar Healthcare. What we do is we help healthcare organisations deliver better healthcare and ultimately deliver better healthcare outcomes. How we do that? We do that through a really cool piece of software, which is Radar Healthcare. And then that helps them underpin a range of things within their organisation and then really process that data information to drive meaningful improvements, outcomes, improvements, etc.
Brilliant. Sounds absolutely fascinating. So maybe if we can start with telling us a little bit more about your background, how you got into business and why this particular business. And I'm really interested to learn more about Radar in general.
Yeah, no, sure. So my background is really electrical engineering. So, you know, from those early days as an electrician, moving into electrical engineering, I worked on traffic signals. I wrote Boolean algebra to help configure traffic signal junctions, this kind of thing. And I progressed into management roles and then into kind of leadership roles around operational, commercial side of things. Worked for a couple of really great CEOs and kind of got the bug seeing those guys as they'd, you know, spun up businesses from scratch and started to really learn from the kind of lessons that they'd apply to their business worlds. Worked with a very clever chap, my co-founder, Lee Williams, our chief operating officer, who was just brilliant at product realization, managing, you know, bringing those ideas to life. So we kind of followed similar careers in the same company, went off doing other things, and we came back together, both living in York. And then we had this idea of, we kind of had a vision of having this really cool, intuitive platform to underpin regulated industry and associated organizations within there. And so we took the plunge 10 years ago, decided to start a company and start to build this really cool platform. I think where healthcare came from is invariably you start to engage with regulated industry. Whilst all were receptive to what we were proposing, two things came across with healthcare. One, it was extremely receptive to what we were proposing to do, but more importantly, it was in need. The industry needed innovation. It needed digital systems like we were proposing. And, you know, it sounds, you know, or it might come across as slightly trite, but basically we're all going to be a part of the healthcare system at some point. So if you have an opportunity to improve that, well, that's just fantastic. So we got the bug very early and we were 100% in, fully invested. Wonderful.
Oh, well, wonderful. I haven't heard the word Boolean algebra for a long time, but we've obviously got some common background. My original business was in software and systems for the power industry. So we did quite a lot of different fun stuff in that particular industry at the time. So really fascinating. And I never thought about that point about, you know, having a business that improves something that ultimately we will need. That's great way of thinking about it. So Paul, just sort of looking backwards, when you're growing up, is this the sort of thing that you always wanted to do, or did you have other ideas?
I think, yeah, I mean, look, I suppose it's, you know, I've got children, you know, that grown up as well, and they're going through this process of deciding what they want to do in life. And I think you never really know when you're at younger age, but I had a passion for technology, engineering, innovation. I've always been fascinated by that. So I kind of knew that I wanted to be involved in that. It was probably later in life as you start to move into management roles and you start to see that some amazing people out there creating things, you know, and things that they can be immensely proud of. So yeah, I got the bug, and then it was probably 20 years ago I thought, yeah, that's something I will want to do, you know, in my life.
Brilliant. And looking back at what you've achieved so far, what would be some of the biggest issues you've had to overcome?
I think this is probably a big challenge for any new business. It's the early stage, because ultimately, I'll tell a great story. In fact, we're having a picture created at the moment, but you have to convince in those early adopters, because ultimately when you start these things, nothing exists. So you create something, whether that's a service that you're going to deliver, a product you're going to realize. And when you go to see those first people, I always tell this story because I think it holds us true to what our aim is. And we went to see an organization in Huddersfield. It was in a converted kind of church, I think it was. We went upstairs, really small healthcare organization. We were open and honest and transparent. This thing doesn't exist. We've built a prototype. We intend to build it. If we build it, would you buy it? You know, and ultimately then we can inform this and look to see how we fund this. And I have the picture somewhere, and the picture is of a Rose's chocolate tin with a laptop balanced on it, and Lee is giving a demo to 4 people in there. And one of the directors said to me, "Here, can you hold this for me, please?" Which was a baby. So I'm stood holding a small child with a laptop balanced on a chocolate tin, and they became our first customer. Now, what's true is we had an absolute commitment to help them deliver better healthcare outcomes. That has not changed from customer number 1 through to customer several hundred now. So, you know, and I think, you know, those kind of origins that, you know, that important lessons that, you know, you don't know where you're going to end up, but if you've got the faith, honesty, transparency, and, you know, deliver against those commitments, you know, do what you say you're going to do.
Brilliant. Fascinating. That again, really interesting. My first business, we moved into an area of power trading, and we had to do something similar. Fun enough, I think we made, it was about ultimately it was about £4 million worth of pre-sales on something we hadn't created. And the same as you, I'd say, look, we want to do this. We know we could do this. We've done something similar before, but we need enough people to sign up for the cost of development. And it's quite challenging. It's a real, I think it's a real feather in your cap looking backwards that you know, we are selling something at the time that didn't exist, and that's wonderful. So you mentioned, you know, several hundred clients. You know, maybe just for people interested, what sort of range or type of clients do you service?
So again, once we better understood healthcare, and that's been a steep learning curve, and I've been so fortunate to be in hospitals, A&Es, care homes, clinics, private acutes, the whole range of organizations, to fully understand what the challenges they have, which are immense, by the way.
Yeah.
And I suppose what we recognize very early is the whole healthcare continuum is as varying sizes. So one thing that we did very early was you need something that's scalable. If you're a single care home or you're a large care home group, you need to be able to service that and support all those organizations. So we support our partners with, as I mentioned there, you know, from the very small care groups right through to some of the biggest brands in the UK, and some of those high street brands from Hoopers to Four Seasons, right through to the small independents. And then we cover the whole healthcare continuum. So GPs, dentists, you know, residential, supported living, acute hospitals, the NHS, you know, we support all the NHS trusts. So it's a wide range, and all multidisciplinary, you know, complex services. From our perspective, it is, you should always have a system that's adaptable to underpin the nuances within different healthcare organizations.
Yeah. And you know, the way you described that there, it's clear, and if, you know, as a layperson, I can see that, but not realize how varied there are, you know, how varied healthcare is across so many different disciplines and different scales, I guess. Yeah, from obviously the NHS itself, but down to individual healthcares and care homes. So you must have learned, you know, a lot over your career. What would you say some of the biggest learnings you've had in business?
Crikey, yeah, there's many lessons. I think one thing that, you know, and sometimes you always talk it, but do you always walk it? And that is the value of people around you. And we've been so fortunate. You know, I'd like to think that, I mean, we invest heavily, you know, on a personal level, as well as within the business, on culture. So so we put a lot of value into people and culture. And you know, and I'd like to think that that feedback would come from our employees. And we've had some people loyal right from the very beginning and have stayed with us. And yeah, the lesson is, you know, that these, you know, ultimately, whilst Lee and I took the plunge and started something, we're nothing, absolutely nothing without those people that wrote the code, people that supported the system, people that helped, just the whole thing. And I say this all the time, that across our organization, every single person plays a part in what we do. Whoever you are, everybody plays a part in our reputation, how we're perceived, strength of the product, our customer experience, everything. So, you know, I think people do all feel a part of it, no matter what your role is in the organization. So that's a big lesson. Just get the right people around you, you know, and you will be successful.
Well, brilliant. It brings to mind, I think there's a story about John F. Kennedy going to NASA, Cape Canaveral, I guess it was at the time.
Yeah.
Talking to people, and he asked the janitor, what do you do? And he said, well, I'm putting a man on the moon. And and it was that, you know, everybody was in it together, everyone doing their job. And one thing I very strongly believe, Paul, which resonates with what you just said, is I've always believed good relationships come with a match of goals. We want to achieve the same thing, but great relationships come with a match of values. We both believe the same things are important. And I think, you know, companies that are founded on a strong set of values and a strong culture are the ones that really thrive, because they attract great people. You know, you don't even need to find them. They actually apply to join, and you know, they want to work with us. And I think that's wonderful. Just talking, you probably we're a coaching organisation, and I wondered who you might say was the best coach you've ever had, and why, whether that's, you know, business, sport, life in general.
I think I mentioned it earlier that, you know, I worked with a couple of great CEOs in previous roles, and you know, you learn a lot from how they operate, and, you know, understand their value and the values that they put into the people and the culture. So I picked on them. But there's, you know, thinking about it, there's one chap I used to work with. Sadly, he's no longer with us, but he had a great name as well. He was called Bronson Fargo, and it wasn't that he was a direct coach to me, or he was part of the senior management team, but his work ethic and approach to people left a lasting mark. Without doubt. You know, you take that on to future roles and how you behave, and that commitment to engaging with people. And it was incredible. It really was. You know, there'd be times where, and you'd think back, did I ever mention it? I can never mention it. I hope your daughter has a great birthday. You know, and I'm thinking, how? I'm sure I never mentioned it, you know, and you're at home and you're at your daughter's birthday party and you get that message.
Well,
and that was, you'd speak to people, and that was across the board, you know, employees, colleagues, customers, just that commitment to, So maybe not so much a coaching, but, you know, where you take something, you think, wow, I aspire to be as good as that. And I've never got close. I try, but I think the memory capacity isn't at that level, I think.
I'm sure you're a lot closer than many, so I'm sure that's pretty cool. There's a great book called The Big Five for Life, which is primarily talking about setting goals in the long term, but it describes this amazing manager as part of the story, and that sort of resonates, that the goal of the manager is to understand each person that worked for them and basically create the environment that was best for them. And it was really, you know, very personalized, and it's a really interesting book with slightly sad ending, unfortunately, but very good. So through business and in life, have you picked up any? I'm a big collector of quotes or sayings, but is there anything that you fall back on in difficult or challenging times?
I have one, which I don't know. I think it is absolutely true as well. So somebody once told me this, and I think I've repeated it a couple of times, and I try to hold it true. And there's a ruthlessness to this as well, which is, you know, when somebody lets you down once, it's their fault. When somebody keeps letting you down, it's your fault. Now, when you actually apply that and think about it, it's not just about saying that you need to get rid of somebody because they're not performing. It's understanding that you need to be involved. Somebody can make a mistake, and that's fine to make a mistake, because people learn from that and adapt and improve. Whereas if somebody is continuously doing that, there needs to be intervention and support and turn that around. And I think quite often people continue to think it's down to somebody because something's failing within the business or function, whatever it is. So get your arms around it, get involved.
Bang on. One of the big principles that we operate in Action Coach is we call it above or below the point of power. And below the point of power, we do blame, excuses, or denial. And above it, we take ownership, accountability, and responsibility. And ultimately, by doing so, I may not be able to change what somebody else does, but I can change my approach to it or how I may interact with them to maybe get a different outcome. And it puts to mind, I know a recruiter that I've known for quite a long time, a really interesting guy, and he told me he often goes to see people and say, you know, who am I replacing? And they'll say, well, you're replacing the sales manager or whatever. And his first question, which either gets him the job or probably gets him kicked out, is, so did you recruit badly or manage badly? And I think it's quite a good way of looking at it, in all honesty.
Yeah, no, absolutely. Yeah, I mean, yeah, I get a bit tired of quotes that get bandied around on LinkedIn and such like, because but there are a few that you see and you think, actually, if you hold yourself to it and apply it, you know, it will hold you true in business. It absolutely will.
I think it's the ones that are most relevant to us personally, if that makes sense. There's lots of great ones and you go, great, that makes sense, I get it, but I'm not engaged with it. It's the ones that really hit us really really strongly. I think I was told one this morning that I really liked, which was we've survived 100% of all the failures we've had so far. So and it's just like bang, absolutely, because it's like it resonates. My similar one to that, which is one of my favorites, is a Japanese saying, which I think is fall down 7 times but get up 8. And that sort of says it all for me, because I think it's okay to make mistakes, and success is often built on making mistakes on a regular basis, you know, and the comfort with which we do so, to accept failure on the way to making it successful, if that makes any sense.
Yeah, no, absolutely. You know, and that's, it's just the opportunity to learn from something rather than a mistake. And I know, again, everybody will, you know, in your whole career and your job, and you make mistakes, you think, right, I won't do that again, or I'm going to put something into, you know, and that's how we adapt, evolve, learn, improve.
Yeah, and hopefully we might talk about innovation later on, but you know, that's part of innovation, isn't it? Without trying different things, we're not going to get a different outcome and a different result. So what would you say are some of the things you've learned about yourself through your career?
Crikey, that's a good one. I think I've realized that my resilience is better than I ever imagined, and maybe just not, you know, those, we just mentioned it there about mistakes, and you perceive them as failures, but actually, just as you're going along, you know, that, you know, you're learning all the time, aren't you? You know, every, I know it's a cliche again, is the every day is a school day, but it just genuinely is, isn't it?
Yeah.
You know, and I think that the thing I've learned is that I am okay with being wrong. You know, I'm not always, I don't need to be the strongest voice in the room. I don't need to be right. And listening. And so, yeah, I think my resilience and ability to adapt and learn, you know, I've certainly learned that that's something that I've actually apply to what I do. So
brilliant, wonderful. And sort of looking forward into the future, what does the future look like for yourself and Radar Healthcare, and what might be some of the challenges you face as you move forward? And I think, you know, you were talking about innovation a little bit earlier, or I think I was keen to know where you're going and what's next.
Yeah, sure. I mean, look, we've been so fortunate. Again, I bring it back to the people that, you know, the people ultimately around us are amazing. We deliver we have a great reputation for our customer experience, and that's held us in good stead. We have an amazing product. We're helping, you know, as I mentioned there, the whole healthcare continuum, and we really do hold ourselves to, if we help, whether you're a care home group, whether you're an NHS hospital, private secondary, primary secondary, if somebody's delivering a better healthcare outcome, then you know, that's a great thing. And so we will continue to expand, because if difference, then it becomes almost a no-brainer for these organizations, because they genuinely want to deliver great service and want to improve and all those great things. And if we can help underpin that, because again, our product is only there to underpin the values and the you know, the people within those organizations. We don't dictate as to how they're going to operate. We're purely there to help them and underpin what they want to do. So reinforcing those. So we will continue to expand. We've now moved internationally. So we're working across the Middle East. In fact, I'm flying out to Saudi next weekend. We're meeting out in Saudi with some of the health clusters there. Again, it's all about that population health management and delivering some, you know, they've got a mission to deliver better, better healthcare outcomes there. So, and we delivered a really great product and project in the UAE. So the Ministry of Health and Prevention in Dubai, which is now the Emirates Health Service, commissioned a project around patient safety for 17 hospitals, 72 healthcare centres across the Emirates. We were extremely fortunate. We were chosen. We delivered that project. And you've mentioned innovation there. We're doing some really great stuff with those guys out there, which we will bring to bear here in the UK, and some of the trusts are already doing it, and some of the big care groups. And that is, we integrate with patient record systems like Cerner and Epic and these kind of things, these EPR systems. Reason we want to do that is we're doing something called IHI triggers, where we're looking for incidents of patient harm. We're applying machine learning and AI in an intelligent way, basically saying our analytics, go and do this hard work for us.
Yep.
Find deviation, find where we need to improve. And then some of the really cool things, which I know we kind of do it a little bit here in the UK, but there's a bit more of a commitment, or, you know, it's more formalized, is excellence reporting. So monitoring, not only using analytics and AI and machine learning to say, who has the lowest number of neonatal deaths? Who has the lowest number of hospital-acquired infections? And when you start to identify why and have a structured process to say, we all aspire to be at that level. So instead of looking for the negative, you're looking for the positive. So doing lots of things around that, working with IoT devices. So integrating with, if it's patient wearables, smart meters in homes to detect reduced mobility, to notify community nursing, which will play a big part in the ICS systems as they evolve. You know, to bridge monitors, which is a commodity activity that should just be automated. So that's where we continuously innovate.
Yep.
You know, deliver systems that are going to fall into the evolving ICS worlds, help population health management, help healthcare organizations improve those outcomes. And invariably, we will continue to expand. We continue to grow. And we've started now some engagement in the US. So I think international will grow, but we want to do it in a sustainable way.
Yeah.
Because we will not compromise the customer experience that we give. So it has to be, first and foremost, we always want to deliver that customer experience, give a great product, and then we can expand into sustainably in those areas. Brilliant.
Wonderful. That sounds like a very, very bright future. So it'd be great to maybe circle back in a year or so and just see, you know, where you are, you know, which other countries you're in, and we did a bit of work overseas, and I know breaking into the States was an interesting challenge actually, and you know, we were lucky enough to have a partner work alongside us, because one thing that we did learn, and I don't know if you found this yet, is that Americans, certainly then, this is going back a few years now, but Americans typically like to buy from Americans, and there was a feeling of while they were quite inquisitive about Brits in general, I think when it came down to some negotiation, it was great to have an American partner with us. But so Paul, you know, a few just simple questions before we wrap up. What would you say to anyone that was thinking of going to business right now?
I mean, I would, you know, once you have your business plan, whether it's a service or products, whatever it is you're going to do, is try and stay true to it, because you can, you know, over the years so we're a healthcare organization. We live and breathe this. I am 100% invested in this. And we've had, you know, approaches from a whole range of different sectors, from cruise liners to high street banks to football clubs to, you know, that because the product ultimately would deliver value and underpin those elements. But that's not who we are. We are a healthcare organization. So we've always stuck to our plan. You know, we've always had a business plan, and you can get, you know, you see things sparkling off to the left and you get drawn to it. My advice is, just stick to your plan, have the faith, and look, it comes down to people and hard work ultimately, and you put the effort in, you get the right people around you. Yeah, spend the time investing in talent.
Brilliant, great, very, very wise words. And just looking back for yourself, if you were to start your business again, is there anything significantly you do differently?
Yeah, probably lots of things. I think I go back to that. I would invest more in talent acquisition earlier.
Right.
I think it was kind of, whilst you always realize the importance of people, getting the right people can be a very labor intensive, stressful activity. So investing as to who do I want, what is the culture I'm going to have, setting out those values from day one. I think I would have invested a bit more time there rather than let it evolve and then starting to drive them.
Brilliant, brilliant. And finally, what would be the best advice you could give to an 18-year-old you if you could go back in time and do so?
Oh, wow. I'd probably say that just relax, because the jobs you're doing are ultimately those stepping stones to what you want to do, and you have to do those things, because I wouldn't be able to do the job I'm doing now had I not been an engineer and understood technology, had I not moved into middle management to senior management to understand P&Ls and commercial elements, to, you know, working with people, developing culture. You know, these are, and I'm not saying that doesn't mean, you know, we've seen some amazing young entrepreneurs that just go straight out of college, university, school, and do amazing things. And I'd always encourage that, but relax. You know, if you're on a journey, you know, I would say to myself, enjoy those jobs, because they are just learning and building blocks to where you will end up. Brilliant.
Again, wise words. And yeah, I sort of resonate. I'm thinking through those. The idea of relaxing is quite difficult, isn't it? Especially when you know, we're not sure. You know, especially, you know, I work with a lot of very driven people, and sometimes, you know, I say, look, let's slow down, speed up. Let's take a step back to see the bigger picture. And again, easy to say, not always easy to do when we're up to our neck in muck and bullets, I think. In a position growth. Well, Paul, thank you so much for your time. It's been absolutely fascinating. As I say, it'd be great if maybe to swing by and catch up with you again in a year or so and just see how Radar Healthcare has developed further.
Yeah, no, I'd love to do that. And yeah, thank you so much for having me today.
Brilliant, thank you.